A grandpa waited 8 months for carcinoma treat just to be said his state had B terminus. Ronnie Andrews, 64, had a tumor on his liver disease found in January 2017, but it was not before September he eventually had chemo. The was 4 persons times much longer rather than the 62-day treat goal set by the Welsh by the government, and by later it was 2 deceased. Cardiff and Valley College Public Health Executive Board told the carcinoma had been hard to detect. I had no terror of possessing the carcinoma, I mind so allows get it of, he told. Yet as period went history I mind so the is fair increasing and not upcoming of. Mr. Andrews' original puncture biopsy was detained since he was not said to halt take his bloodstream dilution tablets. Later, while the puncture biopsy was transferred of, the tumor was skipped, the intended it had to be reiterated. The intermittent added months to his expect for treat. While they at first saw it, it was 5 sm, told Mr. Andrews. Yet by the period they though concerned treat it, it was 15 sm. Apparently it was really cancerous and quick increasing. Later, recent summer, he was said the carcinoma was terminus. He had one treat, a TACE, in that chemo was injected in the tumor. Sadly it had slight effect and he was taking into account among 3 and 6 months to dwell. To the recent 6 months he's been which if they had purified me over. Which if I had been shipped to a various location of year, but how's all a bit deceased currently, he told. Or we're fair wait mainly, wait for it to occur. The Public Health Executive Board told it apologized to Mr. Andrews for breakdowns in communicating, but insisted all of the investigations were clinical required to solve the relevant diagnostic and treat. A representative told, a more than simple diagnostic may just get a pair of weeks, but a carcinoma kind how is hard to detect may sadly get months. Same Public Health Executive Board's productivity versus the Welsh by the government's 62-date norm has superior of 70% in 2015 to 16 to 89% the year in spite treat more than patients every year. Newest monthly average figures showed 90% of patients begun treat during 62 days, reduce rather than the Welsh by the government goal of 95%, that has not been achieved with 2008. Public Health Registrar Von Gething told he was looking at change. The carcinoma treat targets to superior represent the patient expertise. He told, in carcinoma we include a period goal, but how goal doesn't speak you on survival, on the result human beings include, on the expertise they include, or which I'm concerned in is a more extensive talk in the social and human beings work in the NHS. So he's on possessing a set of measures how are smart, how assist to driving the law kind of behavior to enhance expertise and outcomes. Dr. Tom Crosby, of the Wales Carcinoma Web, told more than financing was necessary to enhance the period of diagnostic to treat. He told, until we aware how patient expertise is usually really nice in the carcinoma facility in Wales due to difficult job of personnel, we aware surviving is not as nice as it could be. We believe at low portion of how is associated to the period they expend in the health framework following they are suspected of possessing carcinoma, up they begin treat. For Mr. Andrews any changes will be 2 deceased. He told, same scans are now how it has apparently grown up too big and it is will begin touching the otherwise of my security organs. And we will see while is the some item currently. He's which we're wait to, while. How's which we do currently. We expect. And go on to dwell our lifetime of year. You got to. No selection.